both of these individuals will speak to you shortly. Obviously, this is a rapidly evolving and escalating crisis, and I know that you've heard now from the president, the vice president, and others multiple times over the last 24 hours. Clearly, this situation is escalating and growing more serious, and it deserves a bigger response. And that's what we are doing in Louisiana. But I just want to start by reassuring the people of our state that, as we always have, we're going to get through this. And we're going to do it by being good neighbors to one another. We're going to do it by working together, by cooperating with one another, and certainly we're going to do it by following the directives being given by the federal, the state, and by local government. And I am certainly reminded that in tough times like this, it is always appropriate to remember and to lean on the fact that we are a faithful people. And I am certainly reminded of Isaiah 41:10, "Fear not, for I am with you. Be not dismayed, for I am your God. I will strengthen you. Yes, I will help you. I will uphold you with my righteous hand." So, having said that, I want to get into the briefing now, and that is most essentially, we have significantly ramped up our efforts to mitigate the spread of COVID-19. And I want to describe this again for everybody. We have to flatten the curve so that the peak of transmissions is not as high as it would otherwise be, and that the duration of the event is extended out longer than would otherwise be the case. And we do this to protect the public because we cannot run the risk of overwhelming our capacity to meet the demand for medical services, critical medical services. That's what you're seeing in some places around the world who didn't take aggressive mitigation measures early enough. And so we are doing what we can to get on the front side of that. You should know that earlier today I met with Senator Bill Cassidy. I thank him for coming by and visiting with me. You should also know that I spent about an hour and a half on a telephone call with the president, the vice president, members of the cabinet, and with practically every governor in the state of Louisiana. Following that, I also held a call with mayors and other leaders from around the state of Louisiana. Suffice it to say, we are all in agreement that mitigation measures need to be stepped up significantly and immediately here and around the country. I will remind you that this time last week we had just announced our first positive case of COVID-19. As of this briefing, we now have 136 cases, 22 new cases since our morning update. One of those new cases is in Ascension Parish, the first in the capital region of the state. And sadly, just moments ago, we had our third death, an 84-year-old from Lambeth House in Orleans Parish. And yes, it is still true that the majority of cases are in New Orleans. The number there is currently at 94, 12 cases at the Lambeth House. But to be clear, we have positive cases now across the state. And no one should have a false sense of security when they look at the list of parishes and see which ones have and do not have positive cases. And that is because I suspect, and we have been told, that as we more aggressively test around the state of Louisiana, we will confirm more cases of COVID-19. Further, the cases that are being tested positive today, those exposures likely happened 4, 5, 6, 7 days ago. So even if we are 100% effective in our mitigation efforts today, we are still going to see a rise in cases going into the future. But the fact of the matter is, the best we can hope for from our mitigation measures is a slowdown of the transmission, not that we will be able to stop all transmissions. So if your community has not yet been named, it doesn't mean that the virus isn't present, and it certainly doesn't mean that no one has been tested. It is likely a matter of time before there is a case in your area. And I want everyone to understand that so that when it happens, you are not surprised. The Louisiana Department of Health has confirmed substantial community spread in Louisiana. And it is also true that on a per capita basis, we have one of the highest rates of COVID-19 spread, positive cases in the country. And what concerns me is the healthcare delivery system is sized to meet the needs of a given population. And so having one of the highest per capita number of cases of COVID in the country means that we are at risk for exceeding the ability that we have to deliver health care if we don't slow the transmission and extend the duration of this event. So I cannot stress enough that this is a very serious situation that demands an equally serious response and a prompt response. And that is why we have implemented important statewide measures. When we look at what has worked in stopping the spread of COVID-19 in other countries, it is protective actions that create social distance, because we know the virus spreads easily and swiftly. And in addition to the distance that you have to keep from other individuals, you also have to be mindful that the virus can live on surfaces for some period of time that can extend out several days. So what are we going to do? Tonight, beginning at midnight, we're going to further limit the size of gatherings to fewer than 50 people. We're closing casinos, bars, movie theaters, gyms, and fitness centers, and we're going to limit restaurants to takeout, delivery, and drive-through orders only. And we thank the Restaurant Association in advance for doing the work that they have done and will continue to do with our restaurants. These changes are statewide. At this time, the plan is for operations to resume on April the 13th. However, we will reevaluate the situation a week before, or in the weeks before that, to determine whether these need to be extended. And certainly at all times, we will be looking for additional mitigation measures that might have to be implemented. We are requesting Small Business Administration assistance for businesses that will be impacted adversely by our response to COVID-19. And yes, we are well aware that the CDC has just advised that high-risk individuals should not be in gatherings of more than 10 people. And I cannot stress this enough. The most vulnerable part of our population are these high-risk individuals, and it starts at about age 65 for the elderly. And of course, the more vulnerable they are depends upon how much older they are. But also those individuals with underlying chronic health conditions that may have compromised their immune system. They may have diabetes, heart disease, something, a respiratory ailment, things like that. And you're going to get more information in just a little bit on these matters. And we also know that the CDC guidance is to run these countermeasures for 8 weeks. And therefore, I'm putting the state on notice now that it is much more likely than not that these measures will be continued for an additional 13 days beyond the current expiration date. In addition to closures and modifications, because what I just said is directed at certain establishments, I want to talk to individuals right now, everybody out there, whether you're old, whether you're young, whether you're vulnerable, whether you are not. You should avoid eating or drinking in bars, restaurants, and food courts. Instead, use drive-through, pickup, or delivery options. Cook at home. Go buy your groceries. In New Orleans, as they say, go make your groceries. Cook at home. Avoid discretionary travel, shopping trips, and social visits. Do not visit nursing homes or retirement or long-term care facilities unless you're there to provide critical assistance. And in fact, we know that visitation at nursing homes, hospitals, prisons, and jails has been curtailed in all but emergency matters. Practice good hygiene. Wash your hands, especially after touching any frequently used item or surface. Avoid touching your face. Sneeze or cough into a tissue or the inside of your elbow. Disinfect frequently used items and surfaces as much as possible. I have authorized the mobilization of 400 Louisiana National Guardsmen, of which 150 have already been activated, to provide security at Bayou Signet State Park, which has opened, and to help ensure that things run smoothly at the 3 drive-through testing sites that we hope and believe and are working extremely hard to have come online later this week. And more about those testing sites in just a moment. We are asking those with underlying health conditions and those age 60 or older to limit their social interactions. As I mentioned, those health conditions include heart disease, lung disease, diabetes, and those whose immune systems are compromised, such as those undergoing cancer treatments. Those who fall into one or more of these categories are the most at risk. As for our younger people and those who are not especially vulnerable, you should be practicing social distancing as well. And the fact is that you could be carrying the virus and transmit it to someone who doesn't have a strong immune system, and they could become infected and very sick. When it comes to shopping for basic supplies, you should know that America has the most efficient supply chain system in the world and that it is working. We've been assured in the call with the Vice President and the President that the grocery stores are going to stay open, pharmacies are going to stay open, but we are asking everyone here in Louisiana and around the country, when you go to the store, buy for the week. Don't try to buy for the month or longer. If you keep your normal, usual shopping habits, there will not be a problem. You do not need to hoard items or stock up for extended periods of time. Store hours may change, given the need to clean and restock shelves more frequently. We're asking people to be a good neighbor. Call your elderly family. Call your elderly friends. Call your neighbors with chronic illnesses. Check on them. As I mentioned earlier, to help increase our testing capacity, we expect that later this week in New Orleans, 2 drive-through sites will be established and 1 site for drive-through testing will be established in Jefferson Parish. Individuals will be screened, and these sites are open, and please understand this. These are sites that are being set up in conjunction with the federal government. In preference in Louisiana, we were one of just a handful of states selected. Again, this reflects on the fact that we have one of the highest per capita numbers of cases of COVID-19 in the country, but we were picked by the national government to have these sites. And per their protocols, individuals will be screened, and these sites are going to be open for healthcare workers, first responders, individuals older than 65 or older, and those who are chronically ill, all of whom have to be symptomatic. So those are the individuals who will be tested at those 3 sites, 2 in New Orleans, 1 in Jefferson Parish. Here in East Baton Rouge Parish, the Baton Rouge General Hospital Mid-City location was opened today as a drive-through testing site. This site, however, is open only for ambulatory individuals who have a doctor's order for the test. The general public should not be going to Baton Rouge General Mid-City in order to try to get a test. Instead, any individual with signs or symptoms of the flu or coronavirus must call their medical provider for referral to that community testing center. Only patients with a provider order faxed to the testing center will be administered a COVID-19 test. Upon arrival, patients will show their provider order, state-issued ID, insurance card, and remain in their vehicle while healthcare professionals, administer the test. If you are bringing a child for testing, the guardian's name must match the name on the provider order. all individuals around the state, if you do not have a primary care physician and you looking for help because you're symptomatic and you want a test, you should call 211 for support in connecting you to a healthcare provider. That is 211 for those calls. I know that's a lot of information. I also know that these closures are aggressive and they create a burden on businesses. At a bare minimum, they inconvenience hundreds of thousands of people across our state. I know there are areas of the state that don't yet have confirmed cases of coronavirus. Understand, the experts tell us that coronavirus is currently spread across the state of Louisiana, and we fully expect this to be confirmed by testing in the coming days. And I also know that social distancing goes against the fiber of our beings as Louisianans who love to have parties, crawfish boils, and just look for any excuse to get together and enjoy fellowship with one another. But we are taking these measures on behalf of all of our people, young and old, healthy and sick. I've often said that our ability to work together as Louisianans when times are tough is our best quality. And there's no higher priority for any government or any governor than the health and safety of its people, period. And that is why we are doing what we are doing. And we're doing it in full coordination with our federal partners and the healthcare community. And I'm just going to level with you. Our mitigation measures, no matter how pronounced, no matter how significant they are not going to have their intended effect unless the people of Louisiana abide by them. My executive order will do nothing to slow the spread of coronavirus if the people of Louisiana don't do their part. And I am imploring everyone to take this seriously. Be a good citizen, be a good neighbor. And I have every confidence that you will be. As you know, our K through 12 schools are closed currently. I'm asking you to be patient with schools that are working hard to put non-congregate feeding plans in place. That is happening across the state now. We have more than 20 school districts with feeding sites. These are non-congregate, so these are drive-through feeding sites for these students. School administrators are also working very hard to put lesson plans in place for students and to communicate those lesson plans with parents. Louisiana Public Broadcasting is changing its programming to provide as much educational program as possible, approved by the Department of Education for all ages from K through 12. And so I ask all parents, all students, all teachers to engage in that process as well. Again, for this to work, we all must do our part. And it is critically important that people stay home when they are sick. Now that we have identified community spread, even if we're not sick, we all have to find ways to stay in your homes more often. You're going to be doing social distancing right once you're planning your week and your routines around COVID-19 and fully embracing the mitigation measures that I have announced and any more that might be announced later. And I'm not just talking about New Orleans or Jefferson Parish or St. Tammany or these other parishes where we've identified positive cases. What we're learning is that it can take 2 weeks for symptoms to appear and longer than that for infected individuals to test positive. We believe we are still unearthing community spread that's been around for the past couple of weeks. So make no mistake about it. This is a statewide problem. It demands a statewide solution. My administration, from our frontline health workers to COVID-19 task force that I established earlier this month, is and will continue to take aggressive measures to contain this virus. But we all have a role to play, and protecting not just ourselves, but our fellow Louisianans. If this message sounds a bit extreme, it's because the situation demands that it must be. Again, we are tough, we are resilient, we will get past this, but only because we're going to take it seriously now and do what we've been called upon to do. So, again, I would call upon our faithful people here in Louisiana to not only take the actions that I have just laid out for you, but also to engage in prayer, as I always call upon us to do in times of disaster and crisis. I'm going to be followed now by Dr. Alex Bu, who will provide an update, and then by Dr. Catherine O'Neill from Our Lady of the Lake, who will share a slightly different perspective with you.
Thank you, Governor. So as the Governor noted, we are seeing increased levels of testing around the state, and as we expect, we'll also see increased numbers of cases. Our most up-to-date case number currently is 136, and the state lab continues to operate around the clock, especially for the populations that we need to get an answer to their COVID status as quickly as possible. Importantly, we're also seeing access to commercial lab testing increase throughout the state as well. And as the Governor noted, that's going to be critical for expanding our ability to test and identify COVID in communities around the state, identify individuals who should be isolated to slow the spread in their communities, and ideally slow the spread and move flatten the curve and extend the duration of this current epidemic. So we're working hard in every region around the state with local hospitals and healthcare providers to make sure that they have processes in place to get their tests to us and to grow the number of testing sites around the state. We'll continue to work on that. And so with that, I'll turn it over.
All of us will be affected by this pandemic. All of us in every community will feel the effects of the pandemic. Most of us will become infected over the next many months. 80% of us will not feel the effects of these infections. 80% of us will be asymptomatic, we'll feel well, and we'll continue to go about our daily lives. We'll go to the grocery store, we'll play with our kids, many of us will go to work. But as the Governor said earlier, even asymptomatic people with COVID can spread the infection. That spread is what we're worried about. The most vulnerable part of our population for this infection are the elderly and people with comorbid conditions. The elderly are our grandparents and our great-grandparents. People with comorbid conditions are our peers and our coworkers, the people who teach our children. They're our family members. What does it mean to have a comorbid condition? A comorbid condition is a condition in which another condition is present. It's a very bizarre term. Basically, it means you have two medical conditions. Think about the people in your lives who have two medical conditions, who have 2 bottles of medicine that they take every day. Those people are the people that surround us, and they are at risk of being in the hospital, having severe morbidity, meaning being in a long time in the hospital, and then sometimes, and in this disease often, having a fear of death. We will see people hospitalized at great rates with this infection in this state, and we will see people die. If we continue to allow people who are asymptomatic come into contact with people who are vulnerable to this infection, we will see that rate increase in a way that our healthcare community is not capable of taking care of these patients. If we overwhelm our hospitals now, we will not have enough doctors, nurses, and support staff to take care of patients. We will not be able to offer the best care to your loved ones. We will not have all the medications and the proper equipment needed to treat them. If we flatten that curve by staying in touch with our family members and in touch with our peers and our coworkers, but staying a social distance away from them and only coming into contact in small groups, we will flatten that curve. Many people will still become ill, but we will be able to care for them. We will not overwhelm the healthcare system, and we will allow everyone to receive the care that we expect. How do you do that? How do you help us flatten the curve? You have to put COVID-19 on your calendar. You have to think about your week and think about every gathering in terms of how many people are here. Are we washing hands? Are we wiping shared surfaces? Are we staying a great distance from each other? Could we have done this remotely? If we don't do this, we will not be protecting our friends, our families, and we will lose loved ones. Today, think about the people around you. They are people with comorbid conditions, and they need our help. And our healthcare workers need your help so that every day when we come to our jobs and we come to take care of our patients, we know that we can give the best care. And that is only possible if we slow down this curve of infection, if we allow it to occur over a long period of time, and we let the system take care of each patient the way we want them to be taken care of. I come from a very small town, full of Cajuns, and we love to hug each other, and we love to feed each other, and we are going to have to do that in very small groups, one person at a time, washing our hands each time. And from now on, we're going to have to give some sort of elbow bump, and I would prefer it to be in the air. But if we do that, we'll be here next year, gathering again, having crawfish boils, and going about life. And that's what we ask of everybody. That's what we ask of our healthcare community, and that's what we ask for the citizens in Louisiana. Give us an opportunity to help you by taking care of you in small doses over the next several months and allowing you to receive the best care. Thank you, Governor.
Thank you, Dr. O'Neill. Thank you, Dr. Bu. At this point, it's a good reminder, and I will take your questions. Sam.
Governor, we've seen sort of a dizzying array of escalating restrictions, right? Starting with 250 people banned, now 50 people, now bars and restaurants. Can you just explain to us why exactly, in just a matter of days, what is it you guys are seeing in terms of the numbers? Is it worse than we thought?
Well, first of all, it is obviously worse today than it was last week. But we, at the state level, are heavily dependent upon and relying upon the Centers for Disease Control. And we know that they have more expertise, that they are modeling this, and as their guidance changes, my actions change. And so the things you've seen me put in place have been a direct reflection of what the CDC is saying what we need to have in place. And the CDC is saying these things about the country as a whole, but we know that we are one of the hot spots across the country. So that's why we are doing this. And if you just simply look at what has happened overseas, and I know sometimes we tend to think, well, we're the United States of America. What happened in Italy is not what we're going to see. There is no basis upon which we can know that with any certainty. And in fact, if we don't want to be Italy in terms of this coronavirus outbreak trend and transmission, then we better do things differently, we better do things better, and we better do things earlier. And those are the mitigation measures that we are talking about. And so that's why, as we learn more about this situation, as more information becomes available, then we are taking action. And again, there is nothing associated with this outbreak that I wanted to do, obviously. It's just all essential. As I mentioned earlier, there is no government and no governor that isn't primarily concerned above everything else with the health and safety and well-being of the people that are governed. That's what we're dealing with here today. And so that's why you've seen us do what we're doing. And I think it's not just the dialogue here, although I haven't heard anyone more eloquently state, I think, exactly what we're up against than Dr. O'Neill just did. But it's the conversation that's happening around the country. You've seen, I believe, in the last day or so, a different posture coming from the president and from the vice president, and we're all working together to do what we can for the American public and for the public here in Louisiana. Yes, sir.
As testing increases across the state, whether it be through drive-through or continuing how it has, and more cases pop up, do you expect to see the guidelines for who can get tested, who should get tested, to also expand, or keeping it where it is right now?
Yeah, well, I'm going to let Dr. Bu address that, because he is our specialist at the Office of Public Health when it comes to testing. I do want to try to manage expectations, because I know that it was a few nights ago that there was some communication coming from the federal government about rapidly expanding testing. We don't yet have it in place. We're working very, very hard to put it in place just as soon as possible. And everyone should know there still are some logistical challenges associated with doing what has been represented about these drive-through testing sites. But we do know that as a general matter, over time, the testing capacity, the throughput capacity will greatly increase. Not so much because of additional testing going on at the state public lab, because we're running those tests 3 times a day now, but because we're having more private labs, research labs come online, but the commercial labs like LabCorp, for example, I think yesterday we started getting results back from LabCorp, some positive results that didn't actually go through our state public lab. That was the first time that had happened. So I think over the coming days, you're going to see much more information, much more testing. And again, I will predict to you, you're going to see positives in a greater number of parishes across the state than we've currently seen them. Dr. Buse?
Yeah, that's right. I mean, our current guidelines right now are that anyone that has symptoms of COVID, so anybody who's got fever and cough or shortness of breath, should have a test. Depending on where you are and if you're able to walk up to that test, or if you need to be in a hospital, where we run that test is different. But the guidelines are clear from that point. Whether we're testing you for flu as well may change across the year as we move out of flu season. We see more COVID than flu. But right now I wouldn't expect significant changes, because we want most people to get tested. What I wouldn't expect us to see anytime soon is a change in wanting people without symptoms to be tested. Again, the current tests that we have are not appropriate for those individuals. So I can't predict the future. There may be tests in the future that are appropriate for asymptomatic individuals. And as we learn more about the virus, we may feel that there is a reason to test people at that point. But right now we would not foresee that. And I think what the governor said is worth noting. The entire country now, I think maybe except maybe West Virginia still, has cases. So the entire country is pulling on the same testing material. We're all trying to ramp up our testing to put these methods in place so that we can identify cases, isolate individuals, slow the spread in communities around the country. So that does put constraints on our ability to get to the number of tests we might want. But we continue to work diligently. We're working with the federal government to understand how we can use different reagents, different samples, different methods that will allow us to keep our tests running, even if some of those items that are hard to get at this point continue to be out of stock.
So think about what Dr. B you just said. If you're not symptomatic, you should not be tested. And I'm going to take it one step forward. If you're not symptomatic, you should not ask to be tested, because you will take up time and effort and a test that should be reserved for someone who is symptomatic. But furthermore, if you are not yet symptomatic, your test is going to come back negative, but you actually might have it. You just didn't allow the symptoms to develop. And so you're going to be falsely reassured that you are negative, and you present the greatest risk to everybody, because you're going to think you don't have it. So this gets into being a good citizen and a good neighbor. It's exactly why I haven't been tested, because I am not symptomatic. And we need people to understand that. That's why we have protocols around who should get tested and at these various sites, and what's going to be required, and the screening that's going to be in place in order to try to ensure that the protocols are followed. Yes, sir.
As you said earlier, more than 20 school districts have implemented drive-through feeding sites. Last week you said you expected all of them to. Do you still expect that every parish, every public school system will have that?
Yes, and there's an application that they have to complete and send in order to participate in this. Oddly enough, there are waivers that have had to be granted by the U.S. Department of Agriculture to be able to engage in non-congregant feeding. But those waivers are now in place. These feeding sites are coming online in more districts. I spoke with acting the Secretary of Betsy, I'm sorry, of the Department of Education, and I made sure that she understood that it was our intent, and of course it was her intent all along, to have all school districts offering sites, feeding sites, so that kids have access to nutrition while they are not in school. Yes, sir.
Governor, do you think that people are taking this as seriously as they should in terms of those restrictions? Because we saw a large gathering on Bourbon Street over the weekend, also here in Baton Rouge.
Well, I mean, so I think you answered your own question. There are some people up to now who have not. It is my hope, quite frankly, it is my expectation that with the change in the narrative that's happening here in Louisiana and around the country, with all the additional measures, with the additional cases, with the additional attention that this crisis is generating, that more and more Americans and more Louisianans will take it seriously. And by take it seriously, I mean do the things that we are asking them to do so that we can slow this spread, flatten the curve. Again, the worst case scenario here is that we fail in that, and then we overwhelm our ability to deliver healthcare services. That's what you have seen in certain places around the world. And there is no reason to believe that won't happen right here in Louisiana if we don't do our part to flatten the curve, to slow the spread of this COVID-19 virus. Yes, sir.
Governor, you just announced the first death at the Lambeth House. We've obviously seen elsewhere in the country nursing homes and retirement homes can be a problem with this because of the, for obvious reasons. Can you talk about, is that a particular concern for you guys moving forward?
Well, the answer is yes. So anytime you have any facility that shelters, houses people who are in that most vulnerable category, either because they're older or because they have chronic health conditions, and many of these cases, many of these individuals have, or both, they're older and they have more than one health condition. You have to be especially careful, which is why last week, well ahead of any guidance coming out of Washington, we took it upon ourselves to prohibit visitation to nursing homes, to hospitals, to prisons and jails, because we don't want this virus introduced into those areas. Obviously, Lambeth House is still, as I understand it, the only known cluster in Louisiana, despite the fact that we have a number of cases. Is the only known cluster for coronavirus, and that is very, very tragic because it happens to be a facility that houses older individuals and people with underlying health conditions, both on one side that is an assisted living center, on the other side, which is an independent living. And as far as we know, every infection actually occurred on the independent living side of that facility. But at one time they were sharing their meals in the same area and that sort of stuff. So we have teams of epidemiologists that have been present at Lambeth House since we discovered it as a cluster. And even though I think we've reported 12 cases there, the fact that it hasn't gotten worse thus far, and we are evaluating these people very, very carefully and testing all of them who become symptomatic. I've got my fingers crossed that situation doesn't get worse.
And do you have the number of how many people have been tested so far at the Lambeth House?
I don't have that number, and I don't think Dr. BU does either. But this is what I can assure you: every individual at the Lambeth House, whether they're a resident or worker who has become symptomatic, has been tested. Yes, sir.
As far as offshore workers go, I know a lot have asked questions about being tested or coming back and forth. What's kind of, if anything, guidance as
Well,
far as...
there is no reason for anyone who isn't symptomatic to be tested. And if someone is symptomatic, as Dr. B, you just mentioned, they should contact their healthcare provider. If they don't have a healthcare provider, call 211, explain your situation, explain what your symptoms are, and so forth, and you will be given the proper information about what it is that you should do. Yes, sir.
Governor, the White House has issued, obviously, their guidance, which they're calling 15 days to slow the spread, right? And they've also urged people to avoid gatherings of more than 10 people. So there seems to be some discrepancies. We are obviously extending ours for a month, and we're at 50 people statewide right now, even though I know New Orleans has gone beyond that. Can you talk about why there are some discrepancies right now?
Well, as you know, the CDC changed their guidance last night to 50 people with respect to these gatherings. I'm not sure that the CDC guidance that came out last night has changed. What we saw is they issued additional guidance that said that those individuals who are older, those individuals with chronic health conditions, the more vulnerable people in our population should under no circumstances be in a gathering of 10 or more people. They should avoid those at all costs. And then I know that the president came out and said something, and so I can't reconcile what the differences are. We're going to be working on that. Rest assured that if there is a need for us to change these mitigation measures that we have in place, we will do that. As for the duration, and if I wasn't clear in my prepared remarks, I apologize. We started off with 30 days. And so I changed the mitigation measures, made them more restrictive for that same time period. However, I did acknowledge that the CDC last night said 8 weeks. And so I'm putting the people of Louisiana on notice, and I'm happy to do it again now, that in all likelihood, as we approach that 30-day period, the end of it, we will be extending these measures for at least another month. And that would put us at the 8 weeks. But I'm trying not to create more confusion than is absolutely necessary by changing the deadlines and so forth. But I also want to be very, very clear about that as well. Yes, sir.
Do you foresee any restrictions on daycares at this point? I know a lot of people have called us and have been concerned about that.
Yeah, well, we are not asking daycares to close and for the most part. And the reason is we have a great number of our healthcare workers in particular who are not going to be able to go to work if they do not have child care. And so you have to measure different things, and what is the best solution for the general public may not be the best solution for a certain segment of the public if we're going to get the best we can. And so we are talking specifically to the early learning centers, the child care centers, and we are asking them to do things a little differently, make sure that the kids there are washing their hands more often, perhaps using hand sanitizer, that they're kept in smaller groups where possible, that they're not allowed to have congregate feeding. They shouldn't all be on the playground at the same time and that sort of thing. At the same time, and I'm going to do it again right now, we are asking parents with children, if you don't need them in daycare, if you have the ability to keep them at home with yourself or with an older sibling who is old enough to responsibly take care of them, do that. Don't send them to an early learning center or to a child care center. And so we're trying to be as careful as we can to get the balance right. And we're having constant communications with all of these providers, and the overwhelming majority of which remain open for the reasons that I just indicated. Yes, sir. One more question.
We see things changing at a rapid pace right now. We think about the legislative session. Do you think lawmakers will have time to actually pass a budget, or will the extension come on?
Yeah, and thank you. It's a good question. So I was informed that the Speaker and the President have both agreed to, I don't know if they're calling it a suspension or a recess of the legislature till March 31st.
That vote's final.
I'm sorry?
They voted, both chambers have voted to do it.
Okay. And March 31st is the date given because that is a date by which they have to receive a late filed bill in order for that bill to ever be considered in session. So I think that they did the right thing. They're taking this very seriously. It is my hope that the legislature will be able to reconvene and consider and pass at least the must-pass legislation, not all 1,500 bills or whatever's been filed, But the truth is, there's going to be somewhere between a dozen and 15 or 20 bills that we absolutely have to have before July 1st. July 1st is a new fiscal year, and we need to work to get that done. And we will be working in particular with the Speaker and the President in order to see whether we can do that and do it in a way that have as few legislators meeting at one time as possible, working through their committee structure and so forth. And we have to figure out how we provide alternative ways for the public to provide input and so forth. But we have to get this done, and it's another one of those challenges. And we're going to work hand in hand with the legislative leadership and rank and file members to try to get it done, because it's essential for our state. And I guess it's more imperative than ever. If come July 1st, we're not past this event, and I think you were just told we're not going to be past this event. We may be past the initial worst part of it, but we're not going to be past coronavirus come July 1st. That would be the worst possible time to not have the state agencies, all of them, not just the Department of Health, but all of our state agencies up and working. So we're going to work with them to make sure that we find a way to get the people's business done. It's just important. Look, I'm gonna leave you with that. Thank you again for being here, and I just wanted to tell the Louisiana people again, I really appreciate the resiliency of our people. We are at our absolute best when we work together in times of adversity, and I know that this particular disaster, this pandemic, which is different for us, we've been through a lot in terms of floods and hurricanes and levee breaks and so forth. This is different. But the need for us to come together, be good citizens, be good neighbors, to be patient, to do what local, state, and federal officials are asking of us, it is more paramount now than at any time that I can remember. And so I know that's what we're going to get out of the people of Louisiana. And whether yesterday you knew how serious this was, or whether this morning you knew how serious this was, you know now. And I'm asking you to do your dead level best to help us make through this. And we will. And when we come out, we're going to be stronger. We will have learned lessons from this, and we're going to be better. Our best days are ahead of us, but we all need all of us at this time. God bless you, and thank you so much.
Dr. O'Neill, how do you spell your name?
ONEAL with a C, Catherine.
With a C.
Yep.
Thank you.
It is good.